So it primarily, oncopathology enables you to identify or pinpoint A treatment, B minimizing the effect of treatment over the whole body.
So first is, the first and foremost is making the right diagnosis. A diagnosis with which the physicians and surgeons can work.
Right.
Because without a diagnosis, no treatment can be delivered. And then second, it also helps in continuously monitoring the response through the treatment.
Right.
And then finally, in case the disease in an unfortunate individual recurs, in making the diagnosis second time, and if it is advanced, then finding out the new modalities of treatment.
Doctor, over the years, India, the landscape of India in terms of the healthcare services have improved manifold. And you are possibly one person who has worked abroad, worked in India, and had spent a considerable time working in these places. What significant changes you see in pathological services as far as cancer treatment is concerned?
Oh, I see enormous amount of advancement. Pathology as it was being practiced 30 years back was individual driven, and the level of evidences which were gathered to make a diagnosis were minimal. Then in the intervening 25-30 years, there was initially the introduction of immunohistochemistry, which started enabling the pathologist to gather some evidences in support of the diagnosis. And in the recent past, let's say decade or about a decade, what has actually happened is that now we are gathering more and more evidences to support diagnosis through the DNA and RNA or the genetic makeup of the cancer cells. So in 30 years or 25 years, what I have seen that from a practice which was completely subjective to a practice which has now become very robust, supported by very, very robust evidences. So that is a major change that I have seen in the past 25 years. And I have also seen this, that the expense of this practice is increasing from a few centers to several centers. So if we talk about the city of Delhi, now these levels of evidences are getting gathered by all pathology set up in the city, which was not the case, let's say, about 7, 8 or 10 years back. So the expense has increased and the depth of evidence collection has increased.
Doctor, at this point in time, I would like to ask you two related questions. One is related to the kind of data that you collect. I mean, if so many centers are treating patients and they are doing tests, there's a lot of data which is being generated. So do you find any correlation between the kind of cancer with the kind of lifestyle, maybe the demography of the person? Is it possible to predict something in those lines?
Yeah, I think the cancer has a strong relationship with the lifestyle and the dietary practices. So it is believed that about 30% of the cancers are associated with dietary practices, and a fairly large number are also associated with lifestyle practices, including, for example, betel chewing, smoking, exposure to insecticide, pesticides, heavy use of fertilizers for intensive farming has also been associated with increased rates of cancer in those communities. So I agree with you that the lifestyle and the dietary practice contribute majorly to development of cancer. But there will be several cases where it will not be possible to really pinpoint what has been the cause of development of cancer in that particular individual.
Okay. The whole objective is to preempt cancer. So if we have some intelligence in terms of this kind of lifestyle leads to this kind of cancer, you can actually train people, make them aware of that lifestyle and urge them to change it. I mean, if we are in a situation where you were telling that 95% of the cancer is acquired, is it possible to actually train people?
Well, in some situations are probably, like you can't really do much. It's a large country and you have to feed 120 million people. So you have to participate in intensive farming. One will be using insecticides and fertilizers. So that situation as of now looks not addressable. But there are others, for example, smoking, for example, betel quid chewing, for example, using tobacco, for example, obesity, for example, large use of dairy products. So these are the, for example, use of smoked meat. So these are the risk factors which can be easily avoided, and obviously if we can actually practice good lifestyle, healthy dietary practices, have a balanced food, and there are certain foods which are actually protective against cancer. For example, the use of turmeric, broccoli, green leafy vegetables, many of them have anti-carcinogenic properties. So if there's a right mix of the right kind of a food that can also not just preclude the development of cancer because of bad dietary habits, but also in way prevent the occurrence of cancer because they are anti-carcinogenic elements present in these foods.